was an easy answer. All right.
Should healthcare be a basic human right? He asked us billionaire capitalists who now
uninsured. We've got our private sector
went the other way as far as wanting to be a giver.
Governments in other countries spend half as much as we do. Why do we have these outcomes?
Well, I think we have a confusion between the investment decision and the financing decision. So if you look at the OECD nations, the United States is 34 out of 34 of the OECD nations in value for quality rendered in healthcare. When you look at the overall spend of healthcare and social costs, and you add the two together, we are 12th in the OECD nations. And when you look at the split between healthcare and social, we are the only country that spends more than 42% on healthcare. Everybody else spends less, and they spend the rest on social programs. We spend 62% on healthcare. So what you're seeing is the collision of a social experiment failing into the healthcare system and things like
the healthcare system is full.
Right now,
pay attention to that word.
You've got presidential candidates talking a lot.
Is the country full?
Several of them propose on the Democratic side.
Well, 12 hours in an emergency said, yes, it is.
Fix the challenges that you're talking about. If not, why not?
It won't. And here's why. First, let's define what Medicare for All is, or single payer. And when I ask that question, most people can't answer it. When I ask people, well, tell me a country that has it, they usually offer the UK or Canada. Neither of those countries is a single payer system. There's socialized medicine. It includes not only the financing of healthcare, but the provision of healthcare. If that's what we want, then we have a much bigger lift. But we should be talking to people about what matters to them about their healthcare. What is it about my health that gets in the way of the life I want to lead? And I would introduce this notion that the opposite of health is poverty. And the opposite of poverty is health. It's not wealth. It's I can live a life in a way that is comfortable to me. And what we're finding now is that 10% of people's life expectancy is related to the clinical care they get. 30% is related to the genetic code they have, and 60% is related to where they live. So your zip code is now more determinant of your health and longevity in life than your genetic code or the healthcare system.
Wow.
And oh, by the way, in that 10%, we're spending $3.2 trillion.
What zip do you
live in? Because we're catching
in?
all of the stuff coming out of lifestyle.
So the poor gets it hard.
Until we fix that
like
social
real estate,
determinant
zip
model,
codes.
we're going to continue to have sicker and sicker people, and the system will fail because it'll be overburdened with things it can't deal with.
Overburdened. 12 hours. I was in the hospital yesterday.
You were in, I want to say 17 marketplaces. By the time you left, you'd left almost all of them. You called these marketplaces death spirals. Why?
What was happening was the whole model of insurance is to manage large populations of risk. And when you price the product, and particularly in the Affordable Care Act, we had to price 18 months before the period actually began, by virtue of the way the government built the program. And I remember sitting with President Obama having the conversation, give us time to stabilize the markets, look at this as a 3-year investment. And we did. And we had a set of metrics that we were monitoring on what it would take. And what kept happening is because of the political dialogue in the Senate and the House over what, quote-unquote, Obamacare meant, nothing got solved politically, which it needed to be. We needed legislation to change the things that would stabilize the markets. They kept playing with the risk pools and the risk adjustment and the payment systems in a way that didn't allow us to stabilize the market. And so for us, it was when you get the market in shape and you're ready to play by rules and rules of law, then we will be willing to come back in.
7 to 10 day wait for meds for severe pain at CVS recently.
CVS and Aetna, you've got the Cigna Express Scripts deal that also happened. You've got other ones kind of in the pipeline. Now, these mergers seem good for shareholders, but how are they good for consumers?
Well, if we're going to solve this social determinant problem, we need to get into the home. We now have 60% of the American public who are $400 away from a financial disaster. That's less than most of their deductibles. The next 20% were within $4,000 to $5,000 of a financial disaster. And the current system is so costly by the virtue of the way it's constructed and operated, the healthcare system, that we have to get closer to the home and the community. And so our strategy was to be part of the CVS organization to generate a local presence in every community so that we can arbitrage the high-cost healthcare system by offering more in the home and more in the community. It's placemaking.
Does that mean a CVS becomes a little bit more of an urgent care center, or that I'm getting not just my drugs there, but some of my medical services there, so I don't have to go to a hospital?
Think of it as a community center, and every community is different. So I would argue in low-income neighborhoods where people are on the edge of poverty and always have that fear of free falling into poverty in a very significant way, what can we do to help create a stronger safety net for them?
7 to 10 days for pain meds at CVS in Las Vegas.
Transportation, schooling,
for one of the weeks.
So couldn't we create a store that does that? Couldn't we create a store that has a concierge service that says, let me help you figure out what the next steps ought to be so that you don't fall through the hole and lose everything you have?
Now, you personally have experience with rare disease. Your son had one. What did that teach you about the healthcare system?
It's not a system. It's not a system. It's a bunch of rifle shots by people who are really talented marksmen, but aren't necessarily looking at the whole person.
Tell us about what your son has.
My son had T-cell gamma delta lymphoma. Only 47 people have been diagnosed, all men, all between the ages of 17 and 35. He was 16. So he was the youngest to ever get the disease. They told me he had 6 months left. My wife and I took him around to see doctors. Found a doctor in Boston who said, you know what? The T cells are cancerous, and those are the cells that live under your skin. If we could chase the T cells away, we could cure the cancer. But that means we need to do a bad bone marrow transplant, which is going to create graft versus host disease, which will kill the T cells. And if we can solve the problem of him surviving graft versus host disease, he'll live.
Wow.
Right. 6 months or graft versus host disease. So we chose the graft versus host disease route. I moved into his hospital room with him because it wasn't just the medical care, it was the food on his plate. He was allergic to legumes, and they kept showing up on his plate. He wasn't getting good information. The residents would show up at 2 o'clock in the morning. I'd look over their shoulder to see, are you doing the renal dosing math right at 2 o'clock in the morning after you've been up for 24 hours?
But most people do not have an advocate like you living in their hospital room.
Right. But we need to allow for that. So one of the things we did at Aetna is we created a PTO bank. All of us could donate our excess PTO to a bank where employees who needed to be with their family when they were sick or in crisis could do it without losing pay.
So he was going to get a secondary disease from the treatment.
That's what helping your neighbor.
And that's what destroyed his kidneys, which then I gave him my left kidney in 2007, 5 years later, because that cure went after his kidneys.
Mm-hmm.
Now he's 33 years old. He's got a beautiful daughter and another one on the way, and I couldn't be happier for him.
And how many people are left on meds that do destroy kidneys?
I know what it was. It was over $2 million.
Listen to the cost.
Some of which we had to pay out of pocket.
Mm-hmm.
How good was his insurance?
It was good. It was good.
And they had good insurance.
It was very good.
Yeah. You personally also have had an experience with the healthcare system or the rifle shots, as you call it, that most people wouldn't. Tell us about what happened.
I was skiing with my daughter. I went to check on her. I was going at a high rate of speed. I caught my left edge of my ski, and the tree hit me in the crux of my neck and my left shoulder. I snapped my scapula in half. I macerated my brachial plexus. I pulled the nerve root from my left arm out of my spinal cord. And then immediately unconscious. And I slipped head first backwards down into water, where the water ran behind my neck for 2 hours while they tried to figure out how to get me out of there. And that saved my life. So I broke C2, C3, C5, C6, and T1.
So the cold water was what, freezing you?
Yeah. It was preventing the spinal cord from rupturing. I mean, I have what you would call a quadriplegic injury. That should have either resulted in death or quadriplegic result. And here I am. While I'm walking around with a lot of pain in my left arm all the time. It hurts all the time. It's hurting now. Never stops.
You on pain meds?
Nope.
Yep. Gotta suck it up. Suck it up. Keep them kidneys. You only got one.
I'm assuming that yoga and meditation is not what the doctor ordered. What did they prescribe you?
They prescribed me pain meds. So I was on 7 different narcotics for the first year. I was on Neurontin, Keppra, Vicodin, OxyContin, fentanyl patches, and Dilaudid for breakthrough pain. And it never stopped the pain. I just didn't care. I was so high all the time. Now, lucky for me, and given my experiences in high school and college, I never really had an addictive personality, so I never got hooked on drugs. So I just found it to be, it was like Charlie Brown's mother in the cartoons when she talked. It was like, whoa, whoa, whoa. Everything was just really weird, right? And so, it was recommended to me by my wife and I should get craniosacral therapy. And so we looked for a craniosacral therapist, find one, and I'm going, how does this help? I went for the first visit. It was okay. Taught me something about breathing and managing neuropathic pain. By the 4th visit, I was like, oh my gosh, this is amazing. I started coming off my drugs, and over a period of 6 months, I was off all my drugs.
What does that tell you when, on the one hand, your day job is talking about figuring out the prices for all the very drugs that you were prescribed, and here's a completely different way to think about your health that's working for you, the boss of one of the largest healthcare companies in the country?
That's why I brought it to work. I said, oh my gosh, this is amazing. I was doing the craniosacral therapy, and then I started doing yoga because I couldn't run every morning. And then I got into yoga, the spiritual side of it. I read the Upanishads, Bhagavad Gita, all this stuff, and sort of got really, deep into it. And said, we should do this for everybody in the company. And so I came to work one day. I was the president of the company at the time. I said, let's do yoga and meditation for everybody.
And they're like, he's really hit his head pretty hard.
Yeah. The CMO, the chief medical officer, comes to me about an hour later and goes, this is voodoo medicine, right? Everything's crazy. And I said, well, Lonnie Reisman was his name. What do you think, Lonnie? I mean, what would it take? And he said, well, we have to do a double-blind study. So we did a double-blind study, heart rate variability pre and post, looking at, we categorize people by stress quintile. And the highest quintile of stress in our company, people are spending $1,500 more a year on healthcare than anybody else.
But the more stressed you are, the more likely you are to spend on healthcare.
Right.
And now it's dollars and cents.
Right.
Yep.
So I said,
that's why you help each other take stress off as well.
And 12-week program, mindfulness and yoga. And we had a huge drop in heart rate variability of all the employees, but even more so the people in the top quintile. And it paid for itself.
So if you're a guy that can do this for his company and you see the benefits, why not lay this out for all of the people who are on your insurance plans?
We offered it to all of the people. So people have to want to pay for it if they buy it. They have to understand the trade-offs, which we offered it to everybody. The biggest problem with the program for a lot of our employers where they didn't have the room or they didn't want to give the people the time off. I give them the time off during the day to do the hour of therapy. It was well worth it.
Because it paid back.
Our healthcare costs dropped 7% the next year. Dropped 7%. Not a reduction in trend. They dropped 7% the next year.
So the focus is peace.
That's what, 50,000 people?
The principle is peace.
Look,
so
you're
target.
A guy who has
really
needs,
straightforward.
And we can talk about that, but how has this process taught you from your own life, your son's life, running a company, and all these people that don't have the means to afford this kind of care? I mean, getting back to that first question, should healthcare be a basic right? How can I afford this?
Here's the issue. We have 2 economies in the United States, not an economy. We have a wage economy and we have a wealth economy. And when you look at basic wages since 1970, they've been pretty much flat on a real basis. And if you're in the wage economy, you haven't gained anything. You actually lost. Right? Because costs of goods have gone up, everything else. And for those in the wealth economy, been able to invest in the market, invest in money market funds or, school funds for the kids, they've done really well. And we had this one group of people that we fooled from 1970 to 2008. It was called the middle class because they thought they had an asset that was a wealth asset. It was called their home. And they used it like a wealth asset. And it wasn't. And when it went away, a vast swath of our population fell into that class of just a wage economy.
Look, one of the people are going to say, listen,
Man.
Clearly you know that you're part of the wealth economy, right? Since in those past 40 years, the average raise has been about 11% for the average line worker.
Yeah.
The average CEO compensation has gone up roughly 900%.
Right.
Your exit package out of Aetna is rumored to be around $500 million.
Right.
How do we reconcile this? I mean, yes, the stock of your company is 4 times as big when you walked in, and you've increased performance for shareholders, et cetera. But where do we come to a point where we say, hey, guess what? More of my staff need to be paid better. Perhaps it's taking something out of our C-level executive pockets and investing back into our companies.
And that's what we did with our employees when we raised minimum wage from $12 to $16 an hour and wiped out healthcare costs for 7,000 of our employees.
Right.
We said, you know what, we've got to transfer.
Right.
We're going to pay more, so I paid 62% of all my healthcare
That's
costs.
helping the poor. And the people that make you give back, empower them as well.
For 4 years. And whenever the budget doesn't balance, we'll take it out of the incentive comp pool for the senior team.
See,
versus taking
they're
it
a
out
storehouse.
of comp for the front line.
Churches can do the
So
same.
we did that. We made that trade-off.
Does that
Empower
help
the
become
people.
a more profitable company? Because shareholders can look at this and say,
They created
I don't
it.
know about all this. All I want is my shares to go up every quarter.
On January 2nd, 2015,
Share,
I
baby.
announced the
Give.
rollout of this program. I was in front of the
Give.
JP Morgan conference where 250 million of our 370 million shares were there. And I said, we're doing this. I didn't get one pushback from our shareholders. I got applause from people. And it was the beginning of a whole lot more things, like the PTO bank. We pay student loans as a company. We now doubled our tuition assistance. We did a lot of things like that to improve the quality of life because we gave the organization permission to take care of one another. And so, of the
That's the principle.
rumored more than $500 million,
Create a way to
all
do it.
stock that I never sold.
Take care of one
So I
another.
never traded the stock. My compensation
Companies.
base salary didn't increase
Churches.
until the last year, so it was flat the whole time. although it was
Social.
very handsome, right? But my stock that I got priced into what my compensation was sat in the company coffers and never moved until the deal closed. And more than half of it is now sitting in a foundation that's focused on education, environment, and community sustainability. This very model of moving away from relying on the federal government to try and triangulate on social and economic ecosystems that are so big that they can't do it, they can't move, they just argue with one another and get back to local community and make investments there.
Mark Riddling,
There we go.
Thank you. Good to see you.
Leader. A NASA
it
leader.
for now, but
And
join us
Nipsey
again
Hussle
tomorrow
did the
night
same,
for an
created
exclusive
jobs and gave
interview
back
with
to the
the
community.
German
It's a
counselor
universal
Angela
principle.
Merkel